welcome everybody to, I don't know the number exactly, but at the very least, it's the first seminar of the SPHR Network for the Use of Natural Experiments in Public Health of 2025. And I'm very happy that we have two speakers from quite far away. So we've had speakers before from Europe, from mainland Europe, but this time we've got two speakers from the US. So it's my pleasure to introduce Greg van Riesen, I hope I say that correctly, and Dalia Raymer from the US, who have been doing lots and lots of work over the years on natural experiments and the theory behind natural experiments. They've just published a paper last year with a really interesting and really comprehensive discussion of natural experiments and a new way of thinking about that. So I'm delighted that they're both here to talk to us, and I will stop sharing my screen and I'll hand over to Dalia and Greg to tell us about their work.
Yeah.
So,
Thanks, Frank.
Thank you, Frank. So can everyone see that clearly? I'm just going to move this. So thank you so much, Frank, for this opportunity. Greg and I have really enjoyed our discussions with you, and the paper was very recently published in the American Journal of Evaluation. It's not letting me advance the slide. Oh, there we go. Okay, now it's working. So as you know, the terms and the designs, natural and quasi experiments, are widely used now across a variety of fields. But there are several problems, especially with them as terms. So one is that they're accused of conceptual stretching. One causal inference researcher said, that label natural experiment, it's just marketing for their observational study. So properly articulating different boundaries, their skepticism. And as a result, some notoriously medical journals in particular, if it's not an RCT, you can't use any causal language. I think most importantly, and as we'll try and show you, the terms overlap, are used inconsistently. Sometimes some people use them interchangeably, and that causes confusion across disciplines. And most importantly, I hope we'll show you it fails to specify certain key dimensions. So, and a good example of that is the Oregon health insurance experiment. As you know, or many of you know, the state of Oregon in the US wanted to expand eligibility for Medicaid, its government health insurance program for low-income people, but they didn't have enough money to expand it to the extent they wanted. So they decided to run a lottery, random assignment. And that gave rise to this large literature. And here's an excerpt from a description for a, somewhat broader audience. It is described as both a randomized controlled trial and a natural experiment. So in effect, what you're seeing is conflating whether the study is true random assignment or just quasi-random with whether that identifying variation, and by that I mean where that variation in this case insurance coverage, did the researchers find it out there in the world, a natural experiment, or are they controlling it? So problems like these sort of haunted us, if you will, Greg, from about 20 years ago when Greg and I were writing the first edition of our textbook. We wanted a large presence of natural and quasi experiments, but the existing terms were a problem. We found that in our continued teaching. We couldn't fix it in the second edition. We had other things to do, but we were kind of determined before the third edition, we will work on it, develop a new typology, get a peer-reviewed paper, and cite that. Well, we worked on it, and we had very good response to having different dimensions for naturalness and randomness. But we kept, as we presented it, running into problems, and we had problems when we tried to categorize studies. And one good example of that are instrumental variable studies like this one. So the title is about, do higher cigarette taxes improve birth outcomes? But what people really were most interested in the paper was estimating the effect of a pregnant mother smoking on birth weight. And so you see this from the abstract that they talk about using the cigarette taxes as an instrumental variable to estimate the impact of smoking on birth weight. And we realized we needed a third dimension, which Greg is going to tell you about. So unfortunately, we ran out of time. We didn't get it fully into the third edition. We were able, however, to get rid of some of what we had in the prior issue, especially that natural versus randomness aspect that was also an element in the paper that Frank and some of his co-authors who may be published on conceptualizing natural and quasi experiments. So we were able to get a hint of it, but not fully. So why should you care about terminology? You might say, yeah, I understand what I'm doing and the boundaries and the different trade-offs. Well, there is first teaching and learning. Terminology can help or hinder people learn the conceptual ideas. Similarly, it helps find and understand analyses in other disciplines and literature views. These clearinghouses like Cochrane, they all have different and vague and incomplete terms once they get past RCTs. Perhaps a clear terminology differentiating types of natural and quasi experiments will help with medical journals and such. And finally, we hope to convince you that confusing terminology will limit the studies performed. I know people who think of RCTs as something you do and quasi-experiments as something you find. And that's particularly important in this day and age where practitioners have such enormous amounts of data. They do things in-house, they commission things, and terminology can help our communication and training of them. So what is our framework going to describe? Well, there's obviously lots of things that's relevant about causal research, generalizability, and so on. We're aiming only at what the terms quasi and natural are trying to describe. And that's not exactly a study. It's a combination of two things. The effect you want to estimate. So that's the effect of, which we term the causal variable following Morgan and Winship. So it's one causal variable on one outcome, because particularly for natural experiments, the combination matters. Secondly, we're looking at a particular assignment process in the sense of the Rubin causal model in a context. What is driving the causal variable? How that process relates to the outcome. In econometric jargon, this is often called that identifying variation. What pushing on X are you getting to trace out its causal effect on Y? So now I'm going to turn it over to Greg, and he's going to tell you about our framework, the dimensions, and the typology.
Okay, thanks. Um, yeah, so as Dolly mentioned, we developed this framework, and I'm going to now go through sort of the dimensions we ended up identifying that we think characterize this broad range of research that's described as quasi or natural experiments. And then the dimensions lead to a typology because we have three dimensions: control, exogeneity, and directness. And those three dimensions lead to a typology, a sort of a two by two by two typology of 8 study types. And I'll kind of walk you through that. And then what's key part of the paper is sort of defining these dimensions and describing the typology. And again, the aim here is to try to understand what people are talking about when they use the terms quasi and natural experiments, and aim for maybe a more precise language and a little bit more of a refined typology of how to describe these kinds of causal studies. Hold on. Okay, so the three dimensions of identifying variation we figured are identified as key to this landscape is the dimension of control, which is whether the assignment process is controlled by the researcher, or is it controlled by another decision maker, a policymaker, a law, or even a natural or historical process. And this is really the distinction that we think a lot of people mean when they use the term natural experiment. Natural experiment is something that resembles an experiment, but it's not controlled by the researcher. Whereas there are controlled studies, but not all control studies are randomized. So that's where we think there's a distinct dimension here of researcher control that's separate from randomness, which gets me to the next dimension, which we originally called randomness, but decided to use the broader term exogeneity because random assignment is just one way to create exogenous variation in a treatment. There are quasi-random or exogenous processes that are not random, but yet generate some of the identifying variation that Dolly was talking about. The term exogeneity comes from economics, and it generally means from outside, an influence from outside that's independent of the relationship between X and Y. So it's an influence on the assignment of a treatment that has some independent or exogenous variation in it that lets you better estimate a causal effect. And so sometimes that's a random assignment process, but sometimes it's another kind of process that is still plausibly exogenous, but not fully random. And that's sometimes called quasi-random. That's often what the term quasi-experiment is meant to refer to. And then, as Dolly mentioned, the last dimension we struggled with, but we figured out that this dimension was an important characteristic of a lot of studies that are described as quasi and natural experiments, the directness dimension, the extent to which the link between assignment and the causal variable of interest is more direct, as in like a clinical trial where you directly apply a treatment, or is it more of an indirect kind of encouragement or instrumental variable that's driving the assignment process? Okay, so it's important to mention that each of these dimensions we view as a continuum, even though we dichotomize them for purposes of creating the typology. These are sort of there are fuzzy boundaries between these categories, and so we want to make sure that and I think in the real world these dimensions of causal study designs do have degrees, and they're not bright lines that distinguish the categories. Okay, in coming to working out these dimensions, we found this causal model this model of a causal study to be important. It helped us think through some of the dimensions, and so this is a model we outline in the paper, and we use it to kind of define the different types of studies. And A is in this model is an assignment process, like the flipping of a coin. X is a causal variable of interest, like a treatment versus a control, a drug versus a placebo, and Y is is an outcome of interest. So it's a very simple model, but thinking about it carefully helped us understand what the key dimensions are, and I think it helps define these dimensions. So let me give an example, like with the classic RCT, like the Moderna clinical trial, there A is a random assignment procedure or number. It assigns whether you get the X, the treatment, the vaccine, or placebo control, and Y is the morbidity or mortality outcomes that you measure as part of the study. Now, we extend this model to include the indirect studies that Dahlia mentioned, and I pointed out was one of our key dimensions, in the sense that the assignment process A can indirectly influence X through an instrumental variable or an encouragement Z, which we represented Z. So it could be that you assign people to an encouragement that then influences the instrumental variable. I'm sorry, that then it influences the causal variable, which then influences Y. And so this is um, a little bit more complicated sort of assignment process, but it characterizes a lot of research that's both experimental and natural experiments. And so let me give you an example. The one we give in the paper is a breastfeeding study in Belarus. It's a randomized controlled trial, but hospitals were randomly assigned to a breastfeeding encouragement in the treatment group, and in the control group, it was clinical practice as usual. And the encouragement was a social kind of a education campaign, counseling, information that was provided to new mothers to encourage breastfeeding. But breastfeeding itself could not be randomly assigned. So this is an encouragement Z that influences breastfeeding X, which then in turn influence the outcomes of interest. And and it's important to note that in this kind of study, what happens often is that the women in the treatment group, even though they were encouraged, many of them chose not to breastfeed, and then of course women in the control group who had usual clinical care still chose to breastfeed on their own. And so the intervention only indirectly sort of induced some exogenous variation in breastfeeding, but it was not a direct random assignment of the X variable. And then there's a lot of studies in economics that use this indirect strategy, and they generally refer to it as an instrumental variable strategy. There are many studies of the Vietnam draft lottery in the United States, for example. So that was a random assignment of people to the probability of being drafted into the Army, the draft number, but it only indirectly determined actual military service because many people got out of the draft, but also people volunteered for the Army who were not drafted. And but nevertheless, that exogenous variation from the lottery, the draft lottery, provided a lot of leverage for various studies of the effect of being a veteran, the effect of military service, the effect of the benefits of military service. And that's a common strategy in a lot of econometric studies that are labeled natural experiments, are these sort of indirect instrumental variable studies. So now let me now kind of walk through the typology that results when you look at control, exogeneity, and directness, and their interactions. You get eight study types. And so this is a table that's at the heart of the paper, in which we create or label studies according to their degree of control, researcher control, the degree of exogeneity, and the degree of directness. It creates 8 study types, and you can see them here. So controlled randomized experiment, indirect controlled randomized experiment, natural randomized experiment, indirect natural randomized experiment, controlled quasi experiment, the indirect version of that, and the natural quasi experiment. So these labels, we thought a lot about these labels, and we wanted them to be simple and kind of consistent with existing literature, but more precise. And we're hoping that this typology allows people to talk with a little more precision and kind of understanding about the different types of studies that fall under this broad category. So let me just walk you through a few examples. So I mentioned the Moderna clinical trial. That's a randomized, we call it a controlled randomized experiment, or widely known as RCT, randomized controlled trial. But assignment is random, controlled by the researcher. It's a fairly direct study, and that's a classic example. By the way, this table has some notation which indicates the random, the exogeneity dimension, whether it's random R or quasi-random Q, and then whether it's controlled by the researcher C or natural N as a subscript. So, and I mentioned the indirect controlled randomized experiment, the Belarus breastfeeding study. That's an example of an encouragement experiment. So it only indirectly influences the causal variable of interest, which was sort of the more self-selected behavior of breastfeeding, but Z was the encouragement of that. Now there's natural experiment equivalents of this. So there are natural randomized experiments that are fairly direct. And we give the example, for example, of this study by Rose et al. That looked at the effect of women having a twin brother or a twin sister, growing up with a twin brother or a twin sister. That's sometimes referred to as Mendelian randomization, because the chance of, if you're a twin, of having a fraternal twin or dizygotic twin, the chance that you'll have a brother as opposed to a sister is random. The random chance of the birth, the sex at birth of your sibling, and the researchers were able to look at that to see if there were any effects on later attitudes and behaviors in life of women who grew up with a twin brother as opposed to a twin sister. So that's the assignment is randomized, but it's natural, not controlled by the researcher. It's a birth outcome that's essentially random. So there are indirect versions of natural randomized experiments, and the Vietnam draft lottery studies that I mentioned are a good example of that, because the draft lottery was a true random assignment process, but it only indirectly influenced actual military service and the benefits from that were the causal variable of interest in many of those studies. Let me now move to the non-random side of the chart, which is studies that have non-random assignment but still have some sort of exogenous component to the assignment. So this is important to point out, as Dahlia mentioned, that we want to distinguish these studies, and we think they need to be distinguished from purely observational studies. So even if assignment is non-random, it still needs to have a meaningful component of exogenous variation in order, in our framework, for it to be considered a quasi-experiment. So there are controlled quasi-experiments. These are, and that's maybe a little different than what's in the literature, because sometimes quasi-experiment is associated with the lack of researcher control, but there are researchers can control assignment, but do it in a way that's and do it in a way that's exogenous, but not randomly assign the treatment. So the example here is a ABAB study that we give of a intervention in a nursing home in which Alzheimer's patients were given a treatment that was a robot seal, a fuzzy interactive robot seal, and they were given exposure to that interactive seal on month A, and then they were not given exposure to the treatment on month A. Then and during month B, the second month of the study, they were given exposure to the seal. Then the third month, they were not given exposure to the seal. And the fourth month, they were given exposure to the seal. And that's a classic kind of sometimes called a non-random clinical trial, but an ABAB study. But the researchers are still controlling in an exogenous way the exposure to the treatment and examining its effects. So those are important types of studies, we think, and maybe somewhat underappreciated in many fields. There's an indirect version of that. We give an example of a study so this is researchers controlling the assignment, but in a non-random way, but yet creating some exogenous variation. And we give an example of a school-based study in the Netherlands, in which one school was given and the study looked at the effect of physical activity on school performance. One school was given an encouragement or implemented an encouragement, a school-wide sort of campaign and workshops and posters put up to encourage physical activity. The other school had normal practice. And the idea was to encourage physical activity to see if that had an influence on school performance. So the researchers are controlling the assignment. They're creating some exogenous variation in physical activity, but they're not able to randomly assign students to being physically active or not being physically active. So it's a indirect controlled quasi experiment, a controlled encouragement experiment. And then there are natural versions of this. So there's a natural quasi experiment. And a good example is the many studies of Medicaid expansion in the United States. So these are studies in which the assignment is not random, but still exogenous to some extent and not controlled by the researchers, so controlled by policymakers or the political process. In the United States, Medicaid expansion was adopted by some states, but not by other states. And that allowed researchers to look at the effect of access to healthcare in some states compared to other states and its effect on health outcomes. And finally, there's an indirect version of these natural quasi experiments where the assignment is not controlled by the researcher, but still has an exogenous component, but only indirectly influences the causal variable of interest. And here, the example that Dahlia talked about of cigarette taxes they vary by state and over time. And cigarette taxes influence whether people smoke or not. So cigarette taxes are sort of the instrumental variable influencing smoking behavior, which is X, that may then have an effect on birth outcomes. So there are many studies in economics like this that use the indirect approach, as I mentioned, with instrumental variables. So those 8 study types kind of constitute our typology, and we think kind of represent or describe this wide range of studies in a more precise way. So let me now turn it back over to Dahlia for she's going to talk a bit about the value of the framework and how we think it can be used.
Yeah, thanks, Greg. So I'm going to start with how it supplies a roadmap. And I want to emphasize that this typology, it's not about a form of analysis. It can go with many forms of analyses. I think that some of the questions in the chat got at that. And the way you want to start is you have some effect you want to estimate, the effect of some X on Y. And this is going to provide a series of questions. And we want these questions to be as accessible as possible, to be useful for as wide an audience as possible. The paper has, a fair amount of causal inference and econometric stuff, but that's not really its long-term aim. So perhaps just to pick some of the other examples that I'll use, you want to know the effect of marijuana use on driving accidents, or you want to know the effect of treatment for drug abuse on driving accidents or on marijuana use. Okay, again, there we go. Oh, sorry, it's, I thought I had it starting from, okay. So you start with the typology. And the first question you want to ask is, can you directly control X? So is it use of marijuana or drug treatment? or a a public information campaign. You can control public information campaign and treatment. So let's say you say, yeah, this is something I can control. That enables you to access these different controlled experiments where you can control the thing you want to know the effect of. And your next question is, can you randomly assign X? So if you're speaking to a broader audience, you're going to say, can you use a random number generator to say which people or which organizations or localities get the different values of your treatment or whatever you want to know the effect of? If the answer to that is yes, you get your classic RCT, the gold standard of evidence. But maybe the answer is no. It's like, yeah, they're going to go ballistic if we flip a coin to decide who gets treatment for this or not, but yet we can control it. So then the question is, how well can you control it? How exogenously can you assign X? And of course, this is jargon that takes experts like ourselves. But you can explain to people, yeah, putting it from outside, alternating it in time, controlling who gets it, irrespective of what they want or what's good for them. And in that case, you can do a controlled quasi-experiment, which is, Greg mentioned, we think that's a bit underused. But supposing you can't do, yeah, you control it, but constraints are you can't even do it exogenously. So those are ruled out. Now, this is a natural experiment group, so I'm going to continue looking at the control dimension. I could have gone in another direction. There are other ways to work your way through the map. So now we're looking at cases where, no, can't control it. And the question is, can you find some natural exogenous variation in X, right? So you're looking for a natural experiment, and a natural experiment that is changing the thing you want to know about. If that's true, it opens up these. And again, your next question is, well, that variation did you find? Is it truly random? Is it a lottery? Is it, genetics? If so, that opens you up to the natural randomized experiment, where you're randomizing the thing you want to know the effect of, like eligibility to attend a school or something like that. But most natural experiments are not like that. Most of them, you're stuck with, something less than random, and you're asking, is your found variation exogenous? And that brings up the question of how exogenous. And again, that border into, yeah, we really don't have any exogeneity. And there's, there are only weak statistical tests, right? This is outside knowledge. It's things that you need to look at on a case-by-case basis. So there you have your natural quasi-experiment, like the effect of having a Medicaid program that people in a somewhat higher income range are eligible for on tons of financial, health, etc. outcomes. But again, you may not, and these may be ruled out. So again, we could explore this in different directions, but because this is a natural experiment group, I'm going to continue on the control issue and see where that leads us. So you can't directly control X. You can't find natural exogenous variation in X. So your next question is, can you find some natural exogenous variation in something that drives X? So again, I know I'm switching a little bit the X's, but if you want to know the effect of using marijuana on driving accidents, is there something such as eligibility for treatment programs varying by district and over time that you can use that it pushes the marijuana use? If so, that is going to open up these designs for you. So this is, most of the instrumental variables, although not only. You can see panel diff and diff studies and other things that are formally a different form of analysis or data structure. So then, of course, is that randomizing? Again, do you have some genes that drive something else? The birth example Greg gave. Or, and again, a lot of the instrumental variables studies are over here with the indirect natural quasi-experiments. So we are, pushing the idea that people should explore these options, but that design has problems. I mean, generally speaking, the more indirect, the less controlled, the less exogenous, the more problems, the more things to worry about, the more we need all of the involved methods that have been developed. And there is a reason that epidemiologists are often skeptical of instrumental variable studies like these. But again, it may be the only game in town. So if you don't have these, I want to go back. I want to leave natural experiment and go back to control, where you can't directly control X, and also you couldn't find natural exogenous variation. So now the question we're asking is, can you control something that drives X? So, can you control access to drug treatment if you want to know the effect of using the drugs? And that opens up these options, both the random assignment, and then we have our classic encouragement experiment, like the breastfeeding promotion one in Belarus. Of course, you may be able to control it, but not randomly assign it. So we really think this is underused, and it's indirect, it's not fully randomized. Those are downsides, but control is a bit of an upside. But again, you may not be able to have any of these. And so that just brings us to the observational studies. I want to show you where they fit in. They are not in our typology because we think there's no justification whatsoever for the term experiment. It's endogenous, or if you want, purely observational. We stopped using the term observational because a number of researchers use the term observational for natural experiments. So I've been presenting this as, if you can't do this, try that. I think that's the easiest way to introduce people. But really, we're thinking that you can explore all your options this way. So you can, again, learn about other disciplines' approaches, which in fact, in the long stretch of things, which is exactly what your group is doing. And in particular, you should explore all the options because they come with different strengths and weaknesses, both in general different strengths and weaknesses and context-specific ones. I also hope I can continue that you can find a way to ask practitioners and policymakers. There are people who know what effect they want estimated often, and they're often the ones with the power to create it and the knowledge to find identifying variation. The famous one is, can you persuade them to do a lottery? Doing that, we argue, expands the scope of validly, or at least fairly validly, estimated causal effects. It also, and we didn't think of this until we started speaking with Frank, can help in guidelines. You know, when do you need to worry about a local average treatment effect? What situations like that, to tell people what kinds of things do you need to worry about in your design for the different types of studies. So last thing, the value for consumption of research and analysis. Finding and understanding analyses in other disciplines, again, teaching and learning, which is, you know, textbook writing and teaching is where we really saw the need for this. And we think it can more clearly articulate the boundary with purely observational or endogenous studies. And that is particularly important because the same equations, the same exact forms of data analysis, propensity score matching, diff and diff, and so on are used them. So we think it doesn't supplant other frameworks, it complements them. And of course, all of this is is important for literature reviews and meta-analyses. So thank you very much. Please do contact us via email. And the link, I did put the link in the chat. It's there also.
Great, thank you very much. That was really very interesting, and I recommend everybody to read the paper because it goes into a lot more detail about what was just discussed, and I'm quite looking forward to using this more systematic approach to, you know, study design and evaluation and those kind of things. So I think this is a great contribution from fields aligned to public health. So that's why I was so happy that you want to present this work to us, mostly a public health group. It's time for questions, and I think there's, let me see, there's one question from Leon who that hasn't been answered yet. So maybe we can start with that, and then after that, people can just ask questions directly. But Leon's question is, have you thought about a hierarchy for these different lesser used approaches in terms of strength of evidence? If you have a decision tree, this would be very helpful. I also now see that you did actually answer that, Greg.
Well, I just said it was a good question. We grappled a lot with that. We had some language in the paper, and I think there may still be some suggestion that there are, as Dahlia mentioned, that there are these dimensions have implications for the strength of a study. But we didn't want to go so far as to say that this particular study was stronger, you know, in our typology. That, I mean, obviously RCTs are considered, you know, the gold standard or whatever for causal evidence, but there are many things that determine the strength of evidence of a study, and we didn't want to. And we even got some reviews of the paper that cautioned us against trying to claim that one study type was stronger than another. So we view it more as a sort of a descriptive kind of analytical task and not necessarily a hierarchy of evidence. Although there is sort of the implication, as Dolly mentioned, that less direct, less researcher controlled, and less exogenous studies are not generally as strong. You know?
Right, I think that was the point I was trying to get at, is that I thought that you were suggesting if you have a choice between a controlled versus a natural quasi-experimental design, then probably controlled would be the preferred version.
Yeah, because the researcher can decide things that influence the strength of the study. But of course, you know, there can be very strong natural experiments, right? Where something just happens that the researcher doesn't control, and yet it's very powerful and exogenous, and it lets you, you know, so it's hard to categorically say that. And there are researcher controlled studies that are also weak because they're small or there's contamination. You know what I mean? There's sort of all those complications. But it's
yeah. Can I go? I want to add something, but finish. I'm sorry.
No, I'm done.
Yeah, just going further, it really depends on the situation. I mean, I said control all else equal is better because you know exactly what is being changed, and there may not be drivers you're not aware of or things like that. But like I I think we really did feel that all else equal, going along a dimension towards more control, more randomness, and more directness is better, but it really depends on the specific context. And even without the context, you know, is a controlled quasi experiment better than a indirect natural random experiment? Don't know.
Okay, thanks. It's very helpful. Was the other thing I was thinking about the utility of this approach is that, of course, it would be very helpful if one could have a decision tree where you say, do you have access to this? Do you have control of this? Do you have this? And then you go down and you come up with this is the design we want to go for. But presumably, I understand it gets quite complex, given that, it depends on what you really want to achieve. Because RCTs obviously have, great internal validity, but external validity is not always
Yeah.
great. And so you may favor other things, but maybe it could be built into a decision tree to
That's a
but
great
it's quite
idea. That's a great idea. And I think, Dahlia, you've been working on something like that for your teaching. And we thought of doing some follow-up papers aimed more at a practitioner audience in which we'd sort of do something like that, make a decision tree, because that, in a way that sort of Dahlia walked through the table, because we do want to kind of make the framework useful for decision making like that, and designing programs or rolling out programs.
I have been working on a decision tree. It does get a little messy with so many branches, and yes, I'm still working on it. But it is a little messy, and I did find it easier to go, at least so far, to go through the map with the questions. The other thing is, although I did go through it as, if you can't do this, what about trying that? And but again, we think that at least maybe not as an individual researcher for one study, but more generally, more options are better because they have both internal validity, strengths and weaknesses, as well as external validity, measurement error, measurement validity, and all the other aspects, pros and cons.
Thanks for the very comprehensive answer. Yoav, I think you had a question.
Yeah, thanks, Frank. You can't, there's no way of raising your hand in the react button, so you have to write it in the comments if you want to ask a question. I just wanted to challenge Greg and Dahlia and their sort of emphasis on direct versus indirect randomized approach. So your upper two left-hand boxes. So you gave an example of the Moderna vaccine trial, and you gave an example of actually Mike Kramer's Probit trial, which I know quite well because people in Bristol were involved in the follow-up. The first one's an individual, the second one's a cluster randomized trial because maternity units were clustered. I'm not sure this is really helpful. You're absolutely right that in the cluster randomized trial, which was a behavioral intervention, the effects were weaker. It doubled the rate of breastfeeding from 20 to 10%, though it increased exclusive breastfeeding much more. And in drug trials, we tend to think of it having direct effects. But of course, you could take a drug trial where, because of side effects, compliance is poor. The direct effect may be serum protein X in the blood, but if you don't take the drug, it won't change the protein. But we do an ITT analysis anyway, quite rightly. To me, they're both RCTs. I'm trying to struggle about how helpful is it to break them into direct and indirect, and how do you find direct? Because as I said, the classic example is a drug trial, but if people don't take the drug, it doesn't have any direct effect. It's lying in the rubbish bin.
Yeah. I mean, we struggle with that, and that's an important. That's why we sort of argue that these are continuums, and that there's degrees of directness, but there are some studies we believe that are indirect by design. It's one thing like in the COVID, or in the Moderna trial. I mean, there were some non-compliance, and I'm sure there was some contamination of the control group if they somehow got access to it. But the percentages are small, and it's not at all by design. And of course, that's the example you give of a clearly direct study. But there are these studies that are indirect by design. Like you just cannot, in the same way as you directly administer a drug, you cannot directly administer eating habits, for example, right?
Sure.
Yeah.
But so my point would be those indirect study designs probably are less good at achieving what the aim is to raise X or to change breastfeeding
right.
because they are indirect. So they won't have when you compare the treated and control group, the differences may be less distinct as with the drug trial.
Yeah.
I'm trying to struggle why by making that split, you're making the picture much more complicated because you've now got 8 cells rather than 4 cells. I'm trying to understand conceptually why that's really helping us.
I think for exactly the reason you just said, about it being a weaker thing if it's breastfeeding and not breastfeeding promotion that you want to know the effect on. And, we discuss how extreme lack of compliance or moving towards a lack of compliance or attrition or other things moves you in the direction of indirectness. But again, our focus is not on the formal methods of dealing with that. I mean, using instrumental variables to deal with noncompliance in a randomized experiment, has been going on for a while. It's more, hey, if I want to know the effect of breastfeeding, what can I do to do that?
So clearly with the cluster RCT, we're looking at a sort of real world effect, which is indirect, which won't be. Are you trying to say what would it have been if we could have increased?
I think
the whole cohort?
Cluster issue is a different one, right? The cluster issue is a statistical power problem and things like that. So that is a different issue. And again, it's a well-studied, well-understood issue. You may have a problem getting enough clusters, but people know what to do. And again, we are aiming at understanding this. And when we didn't have directness, or even when we first started thinking about it, we had the problem where people said, like, okay, so does this randomness dimension, as we were calling it then, is that about Z or is that about X? And again, we took this real world strategies perspective and clarifying the use of those terms.
Yeah. But I think one thing you might be saying, I think, and we addressed this a bit in the paper and agree with you on it, is that sometimes there's a direct study of a like a group level intervention, like the effect of the treatment on the treated, and that may be the causal effect of interest, as opposed to the effect of the individual behavior. So it kind of, whether a study is direct or indirect, can also depend on sort of which causal effect you're most interested in estimating. If is it a breastfeeding campaign? Is that the effect that you're interested in? Or are you interested in the effect of an individual mother breastfeeding her child? And so the one is direct and the other one is indirect, kind of, in our framework. So it could be, sort of how you look at it to some extent, and which causal effect you're interested in.
I'll shut up to let other people ask questions.
Thanks, Yoav. There's been quite a long question in the chat, but I think on a slightly simpler level, the question that I had, and I think is closely linked to this, is: are you also thinking about linking the strength of causal language to the typology. So if you go further to the top left, you're allowed to make stronger statements about cause and effect, and if you're in the bottom right, you probably should talk about correlations if you're lucky.
It's
So
a good
I
question.
have a very strong opinion on this. Greg and I agree, but I think I may be stronger. In my opinion, if you want to know the causal effect, you say that. You none of this, oh, we're only looking at associated, and then you read the media accounts and you read the grant proposal and you're like, no way, you don't want to just know associated. So my opinion is you always own the goal, and you may be looking at a pre-post difference where there are tons of problems with that causal conclusion. And once you own the goal, you say estimated effect and you talk about all the problems. And yes, as a general tendency, being in the upper left helps with causal, and being in the lower right harms a causal interpretation. But again, I think Greg said this several times, on it depends, and I think some of the questions say it depends. Just briefly, and I did want to address some of the other things in the chat. I don't agree that nobody studies associations. I think people can be interested in purely descriptive research. And I think a problem in economics, and not only in economics now, is sometimes people are like, it's not causal, it's descriptive. Description can be useful, but I think our point is a lot of time people say association, and what they want and how often people interpret it is causal.
Yeah, just to answer another question in the chat, that and we do say explain this in the paper, that we do see the distinction between intention to treat and treatment of the treated, and then local average treatment effects, and those the language of sort of causal inference around what the estimates you're interested in are. Those are related to our directness dimension. That's very directly related to what we're talking about, is when we explain some of that in the paper. So we are talking about kind of the same sort of set of issues, and people have raised that question in reviewing our paper. Well, is this anything new? Because we all know about noncompliance and these local average treatment effects and the effective treatment on the treated and all. But what we're trying to do is at a different level. It's not kind of at the analytical level of what kind of estimates do you use and procedures do you use to estimate the treatment effect. It's more at the level of what's the design of the study, what's the kind of the strategy being used, and is that a direct strategy or an indirect strategy? And it raises, when it's an indirect study, it raises many of those issues, but it's kind of orthogonal. What we're trying to do is sort of separate from that. We're trying to create more of an accurate language and description of this kind of research. And then there's a bunch of analytical issues that go along with it.
Thank you very much. With that, it's 4 o'clock, and I don't want to keep people longer than they signed up for. So just to first of all thank Greg and Dalia for their excellent presentation and for answering all the questions. And for linking to that paper, which I assume will now have a lot more hits in terms of downloads and references. And for introducing this to the public health community. And I hope we can do something with it, because I think it's a really, really interesting approach. So thank you very much, both.
Yeah. Well, thank you, Frank, for giving us a chance to share our work. And thanks for the comments, everyone.
Yes, that was my next one. I wanted to thank everybody for attending, for listening, and for asking questions. So with that, I'll stop recording, and thank you very much, everybody.
Thank you.
Thank you.
all.